Okay, the 7 rights. The first right is the right drug, is the one that has been ordered by the surgeon or other health care provider. This means that the correct drug must be selected from the operating room or pharmacy stock. Verbal orders are repeated back to the surgeon to verify accuracy. The scrub receives drugs from the circulator at the start of surgery or during the procedure. During the exchange, the drug is verified again. After receiving the drug on the sterile field, the scrub labels the drug and then again selects the correct one when it is requested by the surgeon. Many drug errors made in surgery occur at this point and are related to a lack of labeling or poor labeling. The second right is the right patient. Jasmine is holding up the right patient. Means that the surgical patient is identified on entering the surgical holding area and again when the individual is brought into the surgical suite. So first in the holding area, then in the surgical suite. Before surgery begins, patient identification is again verified during the timeout. So holding area, surgical when they're brought into the surgical suite, and then thirdly during timeout. The third of the 7 rights is the right dose, which means the correct dose or the amount of and strength of the drug is administered for that particular patient. Throughout the medication process, the dose is checked by each person handling the drug. Verifying the correct dose and strength before the drug is administered to the patient is one of the most important responsibilities of the surgical team. The ST must also keep track of the amount of drug given throughout the surgical procedure. The fourth right is the right route. It is the one intended for that drug and is labeled accordingly. So for example, if it says for topical use only or not for use in the eyes, a drug may not be administered by any route other than the one approved and labeled. Some drugs are formulated for different routes but have the same name. The route must be verified by the label. The next is the right time, which refers to a schedule of administration according to the prescription or order. The sixth one is the right indication of the drug and is the condition for which the drug is intended. The right has been added by patient safety advocate organizations in recent years because of numerous drug errors committed when the person administering the drug lacked the appropriate knowledge about indications resulting in injury or death of the patient. The Joint Commission and other standards organizations recognize that patients are cared for by teams of individuals who are jointly responsible for patient safety. In the case of drug administration, drugs are contradicted, must not be administered under the specific conditions. The last of the 7 rights is the right documentation, which means that the drug administration must be documented in the patient chart. Drugs used by the anesthesia provider are documented in the anesthesia record, whereas those used in or on the operative site are documented in the surgical report. All documentation must identify the name of the drug, the strength, who administered the drug, the time, the route, and include a report of patient assessment after administration. And I use the ST book. And lastly, the reason why these 7 rights need to be completed is because, as STs, we need to make sure that we keep our patients safe. And just like Ms. Sherman said in the lecture, in her example of working with the neurosurgeon and how the ST that she had taken over for did not label the 2 saline bottles, and one of them had bacitracin and one of them had the hydrogen peroxide in it. And since that ST didn't properly, label the 2 bottles, then hydrogen peroxide got on the brain of that patient, and obviously the doctor had said, why is this bubbling? And then both of them were dumped out. So that we could really harm the patient, or we could even cause death if we give them, you know, for example, the wrong dose. For example, we give them too much, or you know, we don't, you know, give them in the right route. There's all kinds of things that could happen. So it's our job to keep the patient safe. Wanted to thank my daughter, Elena, for holding up the cards, and my dog, Jasmine, who is now getting a treat for helping out.